drug, procedure, or device, it must be tested. That includes real, live patients. At Munson Medical Center, the cardiac research program is involved in more than a dozen studies right now. Learn about one that has already changed a family's life. This is not what Ron Ramsey's life was like just a few months ago.
We didn't do anything. I mean, we sat around this house because I didn't want him out in the garage tinkering around. I didn't want him using the snow blower. I didn't want him shoveling snow. I wanted him to sit in his chair. Well, now, if you want to do it, go for it.
This was the small device that made such a big difference for Ron's damaged heart.
I had an identical twin brother, and he passed away, just dropped dead at work. So I thought, well, I'm going to go in and get my heart checked. When I went to the heart doctor, he says, "When did you have your heart attack?" I said, "I didn't know I did."
Ron's condition made him a perfect candidate for the Analyze ST, a clinical trial at Munson Medical Center testing new technology.
Our hypothesis is that a heart attack detecting defibrillator will identify these patients, warn them that there's a problem even before they get the chest pain or chest tightness, tell them to get to the hospital. We'll be able to catch it quicker, and as we keep saying, time is muscle.
So basically, it's a defibrillator, a pacemaker, and a heart attack warning system rolled into one.
It's hooked on to the heart here. The defibrillator is here.
Cardiologist Brian Jaffe is the primary investigator of this trial, one of several happening at Munson at any given time.
It's a huge feather in our cap. Our research doesn't bring us huge fame. Our research doesn't bring us huge fortune. But our research helps us keep abreast of the newest trends in clinical research.
The Analyze ST trial started in November, and Ron was the first patient. Along with helping keep him alive, the device is always monitoring his condition. It's linked to a website that sends the results to his doctors daily.
It is truly wonderful technology. In one way, it feels intrusive. On the other way, it's remarkably reassuring that the device is getting smart enough to respond to the physicians so we can care for the patient in real time, so that we can make changes and help them before they get really sick.
Right now, just 7 patients in northern Michigan are helping test the device. They're hoping to enroll 10 to 20. Patients have to need a defibrillator and have an increased risk of heart attack. Ron doesn't regret his decision at all.
I've been feeling great since I've had this device put in.
And neither does his wife, Kelly.
Now, when I leave for work in the morning, I feel like I have, I don't want to say babysitter, but I do. I have someone there with Ron. It might not be a physical being, but I know that if that device vibrates, he's calling 911 and, you know, they know to call me. So it's just a comforting feeling for me. Doctors hope to have all the patients they need by the fall, and they will follow those particular patients for 2 to 5 years.